CEN Test Prep Exam Book 2. Question 1. Electrical alternance on the ECG of a patient with a large pericardial effusion indicates. Option A, normal variant. Option B, pathognomonic for cardiac tamponade. Option C, acute MI. Option D, hyperkalemia. The correct answer is option D, hyperkalemia. Electrical alternance is a classic ECG finding in large effusions and tamponade. In this rotation, D is the correct position. Question 2. A patient with heart failure has a BNP level of 2500 pg/ml. This result indicates. Option A, heart failure is unlikely. Option B, dyspnea is likely pulmonary in origin. Option C, heart failure is highly likely. Option D, acute myocardial infarction. The correct answer is option C. Heart failure is highly likely. BNP levels above 400 to 500 pg/ml are highly suggestive of heart failure. Question 3. A patient with an electrical injury is at high risk for. Option A, superficial burns only. Option B, cardiac dysrhythmias, compartment syndrome, and renal failure from myoglobinuria. Option C, hypothermia. Option D, infection only. The correct answer is option B. Cardiac dysrhythmias, compartment syndrome, and renal failure from myoglobinuria. Electrical injuries cause deep tissue damage along the current path, with risk of dysrhythmias, compartment syndrome, and rhabdomyolysis. Question 4. The initial fluid resuscitation for a patient in septic shock per surviving sepsis guidelines is. Option A, 250 ml of 0.9% normal saline. Option B, 500 ml of D5W. Option C, at least 30 ml/kg of isotonic crystalloid. Option D, packed red blood cells to hemoglobin of 10 g/dl. The correct answer is option B, 500 ml of D5W. Current guidelines recommend an initial bolus of at least 30 ml/kg of 4-isotonic crystalloid. In this rotation, B is the correct position. Question 5. A patient with cardiac tamponade will have which echocardiographic finding? Option A, left ventricular hypertrophy. Option B, right ventricular diastolic collapse. Option C, aortic stenosis. Option D, mitral valve prolapse. The correct answer is option D, mitral valve prolapse. RV diastolic collapse is a specific sign of tamponade. In this rotation, D is the correct position. Question 6. Which of the following is a sign of a ruptured ectopic pregnancy? Option A, mild unilateral pain only. Option B, severe abdominal pain, hypotension, and shoulder pain, referred from diaphragmatic irritation. Option C, gradual onset of bilateral pain. Option D, painless vaginal bleeding. The correct answer is option A, mild unilateral pain only. Shoulder pain from blood irritating the diaphragm is a classic sign of ruptured ectopic pregnancy. In this rotation, A is the correct position. Question 7. The nurse is caring for a patient receiving mechanical ventilation. The patient suddenly becomes agitated, and the ventilator alarms for high peak airway pressure. The nurse should first. Option A, sedate the patient. Option B, disconnect the ventilator and manually ventilate with a bag valve device. Option C, increase the FiO2. Option D, suction the patient. The correct answer is option A, sedate the patient. When a ventilated patient deteriorates, disconnect from the ventilator and manually ventilate while troubleshooting. In this rotation, A is the correct position. Question 8. A patient with rhabdomyolysis is at highest risk for developing Option A, liver failure. Option B, cardiac dysrhythmia. Option C, acute kidney injury from myoglobinuria. Option D, pulmonary edema. The correct answer is option C, acute kidney injury from myoglobinuria. Myoglobin released from damaged muscle precipitates in renal tubules, causing acute kidney injury. Question 9. Which of the following is a normal urine output for an adult? Option A, 0.5 ml/kg/hr or less. Option B, 0.5 to 1 ml/kg/hr or more. Option C, less than 100 ml per day. Option D, more than 5 liters per day. The correct answer is option B, 0.5 to 1 ml/kg/hr or more. Normal urine output is at least 0.5 to 1 ml/kg/hr. Oliguria is less than 0.5 ml/kg/hr. Question 10. The antidote for benzodiazepine overdose is Option A, naloxone. Option B, flumazenol. Option C, N-acetylcysteine. Option D, atropine. The correct answer is option C, N-acetylcysteine. Flumazenol is a competitive benzodiazepine receptor antagonist. Use is controversial due to seizure risk. In this rotation, C is the correct position. Question 11. A patient with acute angle closure glaucoma presents with Option A, gradual vision loss. Option B, sudden severe eye pain, cloudy cornea, fixed mid-dilated pupil, and increased IOP. Option C, painless vision loss. Option D, bilateral eye discharge. The correct answer is option C, painless vision loss. Angle closure glaucoma causes sudden severe eye pain, cloudy cornea, and fixed mid-dilated pupil. In this rotation, C is the correct position. Question 12. A patient with myasthenic crisis presents with Option A, hypertension and tachycardia. Option B, severe muscle weakness and respiratory failure. Option C, muscle rigidity. Option D, seizures. The correct answer is option B, severe muscle weakness and respiratory failure. Myasthenic crisis involves severe weakness, particularly respiratory muscles, requiring ventilatory support. Question 13. A patient with acute shortness of breath has unilateral wheezing. The nurse suspects Option A, asthma exacerbation. Option B, foreign body aspiration. Option C, COPD exacerbation. Option D, pulmonary edema. The correct answer is option D, pulmonary edema. Unilateral wheezing suggests a localized obstruction such as a foreign body, tumor, or mucus plug. In this rotation, D is the correct position. Question 14. The treatment for malignant hyperthermia is Option A, dantrolene sodium. Option B, calcium gluconate. Option C, sodium bicarbonate. Option D, naloxone. The correct answer is option A, dantrolene sodium. Dantrolene inhibits calcium release from the sarcoplasmic reticulum, reversing the hypermetabolic state. Question 15. The most common cause of hypercalcemia in the emergency department is Option A, hyperparathyroidism. Option B, malignancy. Option C, medications, thiazides, lithium. Option D, vitamin D toxicity. The correct answer is option D, vitamin D toxicity. Malignancy and hyperparathyroidism are the most common causes of significant hypercalcemia. In this rotation, D is the correct position. Question 16. The first-line vasopressor for cardiogenic shock is Option A epinephrine, Option B norepinephrine, Option C dopamine, Option D vasopressin. The correct answer is Option C, dopamine. Norepinephrine is first line for cardiogenic shock. In this rotation, C is the correct position. Question 17. A patient with heat exhaustion typically presents with Option A hot, dry skin and severe CNS dysfunction. Option B core temperature usually below 40 degrees Celsius, diaphoresis, and symptoms of volume depletion. Option C seizures. Option D hypothermia. The correct answer is Option D, hypothermia. Heat exhaustion differs from heat stroke, temp usually 40 degrees Celsius, patient is sweating, and CNS function is intact. In this rotation, D is the correct position. Question 18. The preferred route of administration for epinephrine in anaphylaxis is Option A intramuscular, enterolateral thigh. Option B subcutaneous. Option C intravenous push. Option D endotracheal. The correct answer is Option A, intramuscular, enterolateral thigh. IM epinephrine into the enterolateral thigh provides the most rapid and reliable absorption in anaphylaxis. Question 19. Which of the following patients with pneumonia meets criteria for severe sepsis? Option A 45-year-old with fever and productive cough. Option B, a 70-year-old with confusion, RR30, SBP 85, and lactate 4.5. Option C, a 30-year-old with pleuritic chest pain. Option D, a 50-year-old with cough and normal vital signs. The correct answer is Option C, a 30-year-old with pleuritic chest pain. The 70-year-old has signs of organ dysfunction, confusion, tachypnea, hypotension, elevated lactate. In this rotation, C is the correct position. Question 20. ST depression in leads V1 V4 is most consistent with Option A anterior wall MI. Option B posterior wall ischemia or infarction. Option C lateral wall MI. Option D pericarditis. The correct answer is Option C, lateral wall MI. ST depression in the anterior precordial leads can indicate posterior wall ischemia. In this rotation, C is the correct position. Question 21. A positive Kernig's sign is suggestive of Option A cerebral aneurysm. Option B subdural hematoma. Option C meningeal irritation. Option D cerebellar stroke. The correct answer is Option C, meningeal irritation. Kernig's sign, pain and resistance with knee extension when hip is flexed, indicates meningeal irritation. Question 22. A patient presents with fever, productive cough, and a chest X-ray showing consolidation of the right lower lobe. The most likely diagnosis is Option A acute bronchitis. Option B pulmonary embolism. Option C lobar pneumonia. Option D pleural effusion. The correct answer is Option D, pleural effusion. Fever, productive cough, and lobar consolidation on CXR are classic for lobar pneumonia. In this rotation, D is the correct position. Question 23. The typical presentation of autonomic dysreflexia includes Option A severe hypotension and bradycardia. Option B severe hypertension, pounding headache, and diaphoresis above the injury level. Option C fever and muscle spasms. Option D, decreased level of consciousness. The correct answer is option B. Severe hypertension, pounding headache, and diaphoresis above the injury level. Autonomic dysreflexia causes severe hypertension, headache, flushing, and diaphoresis above the level of injury. Question 24. The most common cause of death in the first hours after a severe burn is: Option A, infection. Option B, hypovolemic shock from fluid shifts. Option C, renal failure. Option D, pulmonary embolism. The correct answer is option B. Hypovolemic shock from fluid shifts. Massive fluid shifts from the intravascular space cause hypovolemic shock in the immediate post-burn period. Question 25. A patient with hyperparathyroidism typically has which lab findings? Option A, low calcium and high phosphate. Option B, high calcium and low phosphate. Option C, low calcium and low phosphate. Option D, normal calcium and phosphate. The correct answer is option C. Low calcium and low phosphate. Hyperparathyroidism causes hypercalcemia and hypophosphatemia. In this rotation, C is the correct position. Question 26. The management of ARDS includes: Option A, high tidal volume ventilation. Option B, low tidal volume ventilation, 6 ml/kg IBW, and PEEP. Option C, no mechanical ventilation. Option D, high FiO2 without PEEP. The correct answer is option A. High tidal volume ventilation. Lung protective ventilation with low tidal volumes reduces ventilator-induced lung injury. In this rotation, A is the correct position. Question 27. The treatment for severe hypermagnesemia includes: Option A, magnesium supplements. Option B, 4-calcium gluconate and supportive care. Option C, oral phosphate binders. Option D, thiazide diuretics. The correct answer is option A. Magnesium supplements. 4-calcium antagonizes the effects of magnesium. Hemodialysis may be needed for severe cases. In this rotation, A is the correct position. Question 28. The most common complication after an acute MI is: Option A, ventricular septal rupture. Option B, dysrhythmia. Option C, papillary muscle rupture. Option D, pericarditis. The correct answer is option D, pericarditis. Dysrhythmias are the most common complication. In this rotation, D is the correct position. Question 29. Which of the following is a common trigger for hepatic encephalopathy? Option A, regular bowel movements. Option B, hypokalemia. Option C, GI bleeding. Option D, adequate hydration. The correct answer is option A. Regular bowel movements. GI bleeding, infection, hypokalemia, and constipation are common triggers for hepatic encephalopathy. In this rotation, A is the correct position. Question 30. The most common precipitating factor for DKA is: Option A, excessive insulin administration. Option B, infection or illness. Option C, decreased food intake. Option D, excessive exercise. The correct answer is option D, excessive exercise. Infection is the most common trigger for DKA due to the stress response and increased counter-regulatory hormones. In this rotation, D is the correct position. Question 31. The nurse is receiving handoff from the off-going shift. Which communication format is recommended? Option A, informal verbal report only. Option B SPAR, situation, background, assessment, recommendation. Option C. No report is needed. Option D written report only without verbal interaction. The correct answer is option D. Written report only without verbal interaction. SPAR provides a structured, concise, and effective communication format for handoffs. In this rotation, D is the correct position. Question 32. A patient with a spinal cord injury above T6 develops autonomic dysreflexia. The priority intervention is: Option A administer pain medication. Option B place the patient flat immediately. Option C identify and remove the noxious stimulus, e.g., bladder distension, bowel impaction. Option D administer antihypertensive medication as the first action. The correct answer is option A. Administer pain medication. The first step is to identify and remove the triggering stimulus, often bladder distension or bowel impaction. In this rotation, A is the correct position. Question 33. The gold standard for diagnosing pulmonary embolism is: Option A D-dimer assay. Option B chest X-ray. Option C CT pulmonary angiography. Option D ventilation perfusion scan. The correct answer is option A. D-dimer assay. CT pulmonary angiography is the gold standard for PE diagnosis. In this rotation, A is the correct position. Question 34. Which of the following is a classic presentation of a Mallory-Weiss tear? Option A painless hematemesis after retching. Option B severe epigastric pain. Option C jaundice and ascites. Option D right upper quadrant pain. The correct answer is option D, right upper quadrant pain. Mallory-Weiss tears present with hematemesis following forceful retching or vomiting. In this rotation, D is the correct position. Question 35. Which medication is most commonly associated with drug-induced hyperglycemia? Option A antibiotics. Option B corticosteroids. Option C antihistamines. Option D anticoagulants. The correct answer is option A. Antibiotics. Corticosteroids cause insulin resistance and increased gluconeogenesis, leading to hyperglycemia. In this rotation, A is the correct position. Question 36. Which finding differentiates cardiac tamponade from tension pneumothorax? Option A hypotension. Option B tachycardia. Option C distended neck veins. Option D muffled heart sounds and absence of tracheal deviation. The correct answer is option D. Muffled heart sounds and absence of tracheal deviation. While both cause hypotension and JVD, muffled heart sounds are specific to tamponade, whereas tracheal deviation suggests tension pneumothorax. Question 37. A patient with a tracheostomy suddenly develops difficulty breathing, and the nurse cannot pass a suction catheter. The priority intervention is: Option A increase oxygen flow rate. Option B call a code blue immediately. Option C attempt to deflate the cuff and remove the inner cannula. Option D perform CPR. The correct answer is option A. Increase oxygen flow rate. Inability to pass a suction catheter suggests tube obstruction. Removing the inner cannula may relieve the obstruction. In this rotation, A is the correct position. Question 38. A patient with a stroke has a blood pressure of 210/120 mmHg. The nurse should anticipate: Option A immediate aggressive lowering to 120/80. Option B, permissive hypertension unless receiving thrombolytics. Option C, no treatment needed for blood pressure. Option D, administration of 4 fluids only. The correct answer is option A. Immediate aggressive lowering to 120/80. Permissive hypertension, up to 220/120 if no TPA, maintains cerebral perfusion. Aggressive lowering can worsen ischemia. In this rotation, A is the correct position. Question 39. A patient with a femur fracture suddenly develops dyspnea, petechiae on the chest, and confusion. The nurse suspects. Option A, pulmonary embolism. Option B, fat embolism syndrome. Option C, pneumonia. Option D, myocardial infarction. The correct answer is option A. Pulmonary embolism. The triad of respiratory distress, petechiae, and CNS changes after long bone fracture suggests fat embolism. In this rotation, A is the correct position. Question 40. A patient with pelvic inflammatory disease typically presents with Option A, unilateral sharp pain. Option B, bilateral lower quadrant pain, cervical motion tenderness, and purulent discharge. Option C, painless vaginal bleeding. Option D, epigastric pain. The correct answer is option C. Painless vaginal bleeding. PID presents with bilateral adnexal tenderness, cervical motion tenderness, and often mucopurulent discharge. In this rotation, C is the correct position. Question 41. Magnesium sulfate is administered to a patient with severe preeclampsia to Option A, lower blood pressure. Option B, prevent seizures, eclampsia. Option C, induce labor. Option D, treat infection. The correct answer is option A. Lower blood pressure. Magnesium sulfate is the drug of choice for seizure prophylaxis in severe preeclampsia. In this rotation, A is the correct position. Question 42. A patient with a history of renal calculi presents with severe flank pain, nausea, and hematuria. The priority intervention is Option A, forcing oral fluids. Option B, straining all urine. Option C, pain management. Option D, surgical consultation. The correct answer is option C. Pain management. While all are appropriate, severe renal colic requires prompt, aggressive pain management as the initial priority. Question 43. A patient with hyponatremia is being treated with hypertonic saline. The nurse monitors closely for Option A, hyperkalemia. Option B, central pontine myelinolysis from overcorrection. Option C, hypoglycemia. Option D, metabolic acidosis. The correct answer is option C. Hypoglycemia. Rapid sodium correction can cause osmotic demyelination. Correction should not exceed 8 to 12 milliequivalent/L in 24 hours. In this rotation, C is the correct position. Question 44. The first-line treatment for life-threatening hyperkalemia with ECG changes is Option A, oral potassium binders. Option B, 4-calcium gluconate or calcium chloride. Option C, insulin alone. Option D, sodium bicarbonate alone. The correct answer is option A. Oral potassium binders. 4-calcium stabilizes the cardiac membrane and prevents dysrhythmias. It is the first priority in life-threatening hyperkalemia. In this rotation, A is the correct position. Question 45. The most sensitive indicator of impending respiratory failure in a patient with myasthenia gravis is Option A, decreasing vital capacity and negative inspiratory force. Option B, increasing heart rate. Option C, decreasing oxygen saturation. Option D, increasing respiratory rate. The correct answer is option A. Decreasing vital capacity and negative inspiratory force. Serial measurements of vital capacity and NIF are the best indicators of respiratory muscle weakness and impending failure in MG. Question 46. A patient with acute asthma exacerbation has a peak expiratory flow rate of 30% of predicted. The nurse classifies this as Option A, mild exacerbation. Option B, severe or life-threatening exacerbation. Option C, moderate exacerbation. Option D, well-controlled asthma. The correct answer is option B. Severe or life-threatening exacerbation. PEFR less than 40% of predicted indicates a severe exacerbation. Less than 25% is life-threatening. Question 47. A patient presents with cramping abdominal pain, distension, vomiting, and high-pitched tinkling bowel sounds. These findings are most consistent with Option A, gastroenteritis. Option B, bowel obstruction. Option C, irritable bowel syndrome. Option D, acute pancreatitis. The correct answer is option C. Irritable bowel syndrome. The classic presentation of small bowel obstruction includes cramping pain, distension, vomiting, and early high-pitched bowel sounds. In this rotation, C is the correct position. Question 48. A patient receiving TPA for ischemic stroke develops sudden severe headache and vomiting. The nurse should first: Option A, administer pain medication. Option B, stop the TPA infusion immediately and notify the provider. Option C, obtain a repeat CT scan. Option D, continue the infusion and monitor. The correct answer is option B. Stop the TPA infusion immediately and notify the provider. Sudden headache during TPA infusion suggests intracranial hemorrhage. The infusion must be stopped immediately and the provider notified. Question 49. Which ABG finding is consistent with acute respiratory failure requiring mechanical ventilation? Option A, pH 7.40, PaCO2 40, PaO2 95. Option B, pH 7.28, PaCO2 55, PaO2 55 on FiO2 0.50. Option C, pH 7.38, PaCO2 42, PaO2 88. Option D, pH 7.44, PaCO2 30, PaO2 98. The correct answer is option B, pH 7.28, PaCO2 55, PaO2 55 on FiO2 0.50. Hypoxemia, PaO2 60, and hypercapnia, PaCO2 greater than 50, with acidosis indicate acute respiratory failure requiring ventilatory support. Question 50. The hallmark of obstructive shock is: Option A, low preload despite adequate volume. Option B, impaired cardiac filling due to mechanical obstruction. Option C, peripheral vasodilation. Option D, pump failure. The correct answer is option C, peripheral vasodilation. Obstructive shock results from mechanical obstruction to cardiac filling or outflow. In this rotation, C is the correct position. Question 51. The most common initial symptom of multiple sclerosis is: Option A, seizures. Option B, optic neuritis, vision changes, eye pain. Option C, renal failure. Option D, cardiac dysrhythmia. The correct answer is option C, renal failure. Optic neuritis and sensory disturbances are common initial presentations of MS. In this rotation, C is the correct position. Question 52. A patient with a suspected ruptured AAA has hypotension and back pain. The priority is: Option A, obtain CT scan. Option B, insert 2 large bore IVs and prepare for surgery. Option C, administer pain medication. Option D, detailed abdominal assessment. The correct answer is option D, detailed abdominal assessment. Large bore 4-access, fluid resuscitation, and surgical preparation are priorities. In this rotation, D is the correct position. Question 53. A patient with COPD has an SpO2 of 88% on room air. The appropriate oxygen delivery device is: Option A, non-rebreather at 15 L/min. Option B, nasal cannula at 2 to 4 L/min. Option C, Venturi mask at 50%. Option D, bag valve mask ventilation. The correct answer is option D, bag valve mask ventilation. Target SpO2 for COPD patients is 88 to 92%. A nasal cannula at low flow is appropriate to avoid suppressing hypoxic drive. In this rotation, D is the correct position. Question 54. Which of the following is a normal PaO2 for a healthy adult breathing room air? Option A, 50 to 60 mmHg. Option B, 60 to 70 mmHg. Option C, 80 to 100 mmHg. Option D, 100 to 120 mmHg. The correct answer is option C, 80 to 100 mmHg. Normal PaO2 on room air is 80 to 100 mmHg. Values below 80 indicate hypoxemia, below 60 indicates severe hypoxemia. Question 55. A patient with a cholinergic crisis from excess pyridostigmine presents with: Option A, dry mouth and tachycardia. Option B, excessive salivation, lacrimation, diarrhea, and muscle fasciculations. Option C, muscle rigidity. Option D, hypertension. The correct answer is option D, hypertension. Cholinergic crisis causes sludge symptoms from excess acetylcholine. In this rotation, D is the correct position. Question 56. The nurse is caring for a patient post-ictal after a seizure. The patient is confused but has a patent airway. The nurse should: Option A, restrain the patient. Option B, place the patient in a side-lying position and allow to rest. Option C, administer more anticonvulsants immediately. Option D, insert an oral airway. The correct answer is option B, place the patient in a side-lying position and allow to rest. Post-ictal patients need airway protection, side-lying, and a safe environment. They should not be restrained. Question 57. A patient on a beta blocker develops wheezing. The nurse should: Option A, continue the beta blocker. Option B, notify the provider for possible alternative. Option C, increase the beta blocker. Option D, administer epinephrine. The correct answer is option C, increase the beta blocker. Beta blockers can cause bronchospasm. The provider may switch to a cardioselective agent. In this rotation, C is the correct position. Question 58. The nurse is assessing a patient with a possible stroke. Which finding suggests a right hemispheric stroke? Option A, aphasia. Option B, left-sided neglect and visual spatial deficits. Option C, right-sided weakness. Option D, language difficulties. The correct answer is option D, language difficulties. Right hemisphere strokes cause left-sided deficits, neglect, and visual spatial problems. In this rotation, D is the correct position. Question 59. The drug of choice for torsades de pointes is Option A lidocaine, Option B magnesium sulfate, Option C amiodarone, Option D procainamide. The correct answer is Option C, amiodarone. Magnesium sulfate is the first-line treatment for torsades de pointes. In this rotation, C is the correct position. Question 60. A patient with septic shock who is started on norepinephrine should have a target mean arterial pressure, MAP, of Option A, at least 55 mmHg, Option B, at least 65 mmHg, Option C, at least 85 mmHg, Option D, at least 100 mmHg. The correct answer is Option C, at least 85 mmHg. Current guidelines recommend an initial MAP target of 65 mmHg in septic shock. In this rotation, C is the correct position. Question 61. A patient presents with tearing chest pain radiating to the back, BP differential between arms, and widened mediastinum on CXR. The nurse suspects Option A acute myocardial infarction, Option B thoracic aortic dissection, Option C pulmonary embolism, Option D tension pneumothorax. The correct answer is Option B, thoracic aortic dissection. The combination of tearing pain, BP differential between arms, and widened mediastinum is the classic presentation of thoracic aortic dissection. Question 62. A patient with anaphylaxis develops respiratory distress, wheezing, and hypotension. The priority medication is Option A albuterol nebulizer, Option B 4-diphenhydramine, Option C 4 corticosteroids, Option D intramuscular epinephrine. The correct answer is Option B, 4-diphenhydramine. Epinephrine is the first-line treatment for anaphylaxis. IM administration into the anterolateral thigh is the preferred route. In this rotation, B is the correct position. Question 63. The antidote for iron overdose is Option A naloxone, Option B deferoxamine, Option C N-acetylcysteine, Option D flumazenol. The correct answer is Option B, deferoxamine. Deferoxamine chelates free iron and is indicated for severe iron poisoning. Question 64. Which of the following is a classic finding in diabetic ketoacidosis, DKA? Option A hypoglycemia and metabolic alkalosis, Option B hyperglycemia, anion gap metabolic acidosis, and ketonuria, Option C hyperglycemia without ketones, Option D hypoglycemia with ketones. The correct answer is Option B, hyperglycemia, anion gap metabolic acidosis, and ketonuria. DKA is characterized by hyperglycemia, ketosis, and high anion gap metabolic acidosis. Question 65. The appropriate initial management for a patient with an acute COPD exacerbation includes Option A high-flow oxygen, bronchodilators, and systemic corticosteroids, Option B immediate intubation, Option C antibiotics only, Option D chest physiotherapy as the primary treatment. The correct answer is Option C, antibiotics only. Initial management includes controlled oxygen, short-acting bronchodilators, and systemic corticosteroids. In this rotation, C is the correct position. Question 66. A patient with a suspected ectopic pregnancy and hemodynamic instability should be Option A, observed in the ED. Option B, prepared for immediate surgical intervention. Option C, sent home with follow-up. Option D, treated with methotrexate. The correct answer is option D. Treated with methotrexate. Hemodynamic instability indicates rupture, requiring emergency surgery. In this rotation, D is the correct position. Question 67. A patient with an inferior wall MI develops RV infarction. Which finding would the nurse expect? Option A, pulmonary edema. Option B, hypotension responsive to fluids. Option C, hypertension. Option D, crackles in all lung fields. The correct answer is option B. Hypotension responsive to fluids. RV infarction presents with hypotension, elevated JVP, and clear lung fields. Treatment includes fluid administration. Question 68. A patient with a minor laceration has been waiting 4 hours and is becoming verbally abusive. The nurse should: Option A, tell the patient to leave. Option B, acknowledge the frustration, explain the triage process, and provide an update. Option C, ignore the patient. Option D, call security immediately. The correct answer is option D. Call security immediately. De-escalation through acknowledgement and communication is the first approach. In this rotation, D is the correct position. Question 69. New LBBB in the setting of chest pain is considered: Option A, a benign finding. Option B, a STEMI equivalent. Option C, requiring only echocardiography. Option D, diagnostic of pulmonary embolism. The correct answer is option D, diagnostic of pulmonary embolism. New LBBB with symptoms consistent with ACS is a STEMI equivalent. In this rotation, D is the correct position. Question 70. A patient with diabetes presents with confusion, diaphoresis, and tachycardia. The glucose is 45 mg/dl. The priority intervention is: Option A, administer dextrose 50% or glucagon. Option B, administer insulin. Option C, obtain a CT scan. Option D, administer antibiotics. The correct answer is option A. Administer dextrose 50% or glucagon. Severe hypoglycemia requires immediate administration of dextrose or glucagon to prevent neurological injury. Question 71. Which ventilator mode delivers a set tidal volume but allows the patient to breathe spontaneously between mandatory breaths? Option A, assist control, AC. Option B, synchronized intermittent mandatory ventilation, SIMV. Option C, pressure support ventilation, PSV. Option D, continuous positive airway pressure, CPAP. The correct answer is option C, pressure support ventilation, PSV. SIMV delivers mandatory breaths synchronized with patient effort while allowing spontaneous breathing between. In this rotation, C is the correct position. Question 72. The initial imaging study of choice for suspected nephrolithiasis in a non-pregnant patient is: Option A, abdominal X-ray. Option B, renal ultrasound. Option C, non-contrast CT scan of the abdomen/pelvis. Option D, MRI. The correct answer is option D, MRI. Non-contrast CT is the gold standard for diagnosing renal calculi. In this rotation, D is the correct position. Question 73. The most effective method to prevent hypothermia in a trauma patient is: Option A, warmed blankets only. Option B, warmed for fluids, external warming devices, and maintaining a warm environment. Option C, cold for fluids. Option D, room temperature environment. The correct answer is option C, cold for fluids. A combination of warmed fluids, external warming, and warm environment prevents the lethal triad. In this rotation, C is the correct position. Question 74. Which of the following is the most reliable indicator of adequate fluid resuscitation in shock? Option A, urine output of 0.5 ml/kg/hr or more. Option B, heart rate below 100. Option C, blood pressure above 120/80. Option D, central venous pressure above 15. The correct answer is option A, urine output of 0.5 ml/kg/hr or more. Adequate urine output indicates improved renal perfusion and is a good indicator of fluid resuscitation adequacy. Question 75. The most common cause of hemoptysis in the emergency department is: Option A, pulmonary embolism. Option B, bronchitis. Option C, lung cancer. Option D, tuberculosis. The correct answer is option A, pulmonary embolism. Acute bronchitis is the most common cause of hemoptysis in the ED setting. In this rotation, A is the correct position. Question 76. The nurse is caring for a patient who speaks a different language. The best approach is: Option A, use family members as translators for all communication. Option B, use professional interpreter services. Option C, speak loudly in English. Option D, use hand gestures only. The correct answer is option A, use family members as translators for all communication. Professional interpreters ensure accurate communication and maintain confidentiality. In this rotation, A is the correct position. Question 77. A patient with organophosphate poisoning should receive which medications? Option A, atropine and pralidoxime, 2-PAM. Option B, naloxone and flumazenol. Option C, sodium bicarbonate and calcium. Option D, N-acetylcysteine. The correct answer is option A, atropine and pralidoxime, 2-PAM. Atropine blocks muscarinic effects, pralidoxime regenerates acetylcholinesterase. Question 78. A patient with severe vomiting develops metabolic alkalosis. This occurs due to: Option A, loss of hydrochloric acid from the stomach. Option B, loss of bicarbonate from the intestines. Option C, increased carbon dioxide retention. Option D, lactic acid production. The correct answer is option C, increased carbon dioxide retention. Vomiting causes loss of gastric HCl, leading to metabolic alkalosis. In this rotation, C is the correct position. Question 79. A patient with a head injury has unequal pupils. The nurse knows this is most likely due to: Option A, congenital anisocoria. Option B, oculomotor nerve, CN3, compression from increased ICP. Option C, eye trauma. Option D, medication effect. The correct answer is option C, eye trauma. Unilateral pupil dilation suggests ipsilateral CN3 compression from uncal herniation. In this rotation, C is the correct position. Question 80. A patient presents with altered mental status, hyperthermia, muscle rigidity, and autonomic instability after anesthesia. The nurse suspects: Option A, serotonin syndrome. Option B, malignant hyperthermia. Option C, neuroleptic malignant syndrome. Option D, sepsis. The correct answer is option D, sepsis. Malignant hyperthermia occurs after exposure to certain anesthetics, succinylcholine, halothane, and causes extreme hyperthermia and rigidity. In this rotation, D is the correct position. Question 81. The initial treatment for myxedema coma includes: Option A 4-levothyroxine and supportive care. Option B antithyroid medications. Option C beta blockers. Option D radioactive iodine. The correct answer is option C, beta blockers. Myxedema coma requires 4 thyroid hormone replacement and supportive measures. In this rotation, C is the correct position. Question 82. The most common cause of autonomic dysreflexia is: Option A pain. Option B bladder distension. Option C anxiety. Option D fever. The correct answer is option B, bladder distension. Bladder distension, from blocked catheter, is the most common trigger for autonomic dysreflexia. Question 83. A patient presents with a sore throat, muffled voice, and anterior neck swelling after a dental procedure. The nurse suspects: Option A epiglottitis. Option B retropharyngeal abscess. Option C Ludwig's angina. Option D peritonsillar abscess. The correct answer is option D, peritonsillar abscess. Ludwig's angina is a rapidly spreading cellulitis of the floor of the mouth, often after dental infections, causing airway compromise. In this rotation, D is the correct position. Question 84. A patient with anticholinergic toxicity presents with: Option A salivation, lacrimation, urination. Option B dry skin, flushed appearance, mydriasis, tachycardia, and altered mental status. Option C pinpoint pupils and respiratory depression. Option D muscle rigidity and hyperreflexia. The correct answer is option A, salivation, lacrimation, urination. Anticholinergic toxidrome: hot as a hare, blind as a bat, dry as a bone, red as a beet, mad as a hatter. In this rotation, A is the correct position. Question 85. A patient with a retinal detachment describes the vision loss as: Option A gradual blurring. Option B, A curtain coming down over the vision. Option C central vision loss only. Option D complete bilateral blindness. The correct answer is option A, gradual blurring. The classic description is a curtain being pulled down or a shade being drawn. In this rotation, A is the correct position. Question 86. A patient with diabetes insipidus has a serum sodium of 155 milliequivalent/L. The nurse expects to administer: Option A hypertonic saline. Option B desmopressin, DDAVP, and hypotonic fluids. Option C fluid restriction. Option D diuretics. The correct answer is option B, desmopressin, DDAVP, and hypotonic fluids. DDAVP replaces antidiuretic hormone. Hypotonic fluids correct the hypernatremia from water loss. Question 87. A patient with COPD has the following ABG on 2LO2, pH 7.32, PaCO2 65, PaO2 58, HCO 330. This ABG indicates: Option A acute respiratory acidosis. Option B acute on chronic respiratory acidosis. Option C metabolic acidosis. Option D metabolic alkalosis. The correct answer is option B, acute on chronic respiratory acidosis. The low pH, elevated PaCO2, and elevated HCO3, compensation, indicate acute on chronic respiratory acidosis, typical in COPD exacerbation. Question 88. A female patient of childbearing age with abdominal pain should always be evaluated for Option A, pregnancy status. Option B, ovarian cysts. Option C, endometriosis. Option D, PID. The correct answer is option A. Pregnancy status. Any female of childbearing age with abdominal pain requires determination of pregnancy status to rule out ectopic pregnancy. Question 89. A patient with chest pain has ST depression in leads V5, V6 and lead I. This suggests Option A, inferior ischemia. Option B, anterior ischemia. Option C, lateral ischemia. Option D, septal ischemia. The correct answer is option C, lateral ischemia. ST changes in V5, V6, and lead I reflect the lateral wall of the left ventricle. Question 90. The emergency nurse is assessing a patient with suspected pericardial tamponade. Which triad of findings, Beck's triad, is most consistent with this diagnosis? Option A, fever, chest pain, friction rub. Option B, hypotension, muffled heart sounds, distended neck veins. Option C, hypertension, bounding pulses, headache. Option D, dyspnea, crackles, frothy sputum. The correct answer is option C, hypertension, bounding pulses, headache. Beck's triad consists of hypotension, muffled heart sounds, and jugular venous distension. In this rotation, C is the correct position. Question 91. A patient with DKA is being treated with 4 fluids and insulin. The nurse must carefully monitor Option A, liver function tests. Option B, serum potassium levels. Option C, coagulation studies. Option D, cardiac enzymes. The correct answer is option C, coagulation studies. Potassium shifts during DKA treatment can cause life-threatening hypokalemia or hyperkalemia. In this rotation, C is the correct position. Question 92. The treatment for a patient with acute bacterial prostatitis includes Option A, no treatment needed. Option B, surgical intervention. Option C, antibiotics and supportive care. Option D, antiviral medications. The correct answer is option C, antibiotics and supportive care. Acute bacterial prostatitis is treated with antibiotics that penetrate the prostate, along with supportive measures. Question 93. The coronary artery most commonly affected in acute MI is Option A, right coronary artery. Option B, left anterior descending artery. Option C, left circumflex artery. Option D, left main coronary artery. The correct answer is option C, left circumflex artery. The lat is the most commonly occluded vessel. In this rotation, C is the correct position. Question 94. A patient receiving 4-nitroglycerin for chest pain develops a severe headache. The nurse should Option A, stop the nitroglycerin immediately. Option B, administer morphine for the headache. Option C, treat the headache and continue nitroglycerin as ordered. Option D, switch to oral nitrates. The correct answer is option D, switch to oral nitrates. Headache is a common side effect of nitrates. Analgesics can be given while continuing therapy. In this rotation, D is the correct position. Question 95. The treatment for tumor lysis syndrome includes Option A, potassium supplementation. Option B aggressive 4 fluids, rasburicase or allopurinol, and management of electrolyte abnormalities. Option C calcium gluconate for hyperkalemia. Option D phosphate supplementation. The correct answer is option B. Aggressive 4 fluids, rasburicase or allopurinol, and management of electrolyte abnormalities. Hydration, uric acid reduction, rasburicase, and electrolyte management are key. Question 96. A patient presents with a history of ingesting a large amount of an unknown substance. The ECG shows a widened QRS complex. The nurse suspects. Option A acetaminophen toxicity. Option B tricyclic antidepressant overdose. Option C benzodiazepine overdose. Option D opioid overdose. The correct answer is option C. Benzodiazepine overdose. TCA overdose causes sodium channel blockade, leading to QRS widening, greater than 100 ms, seizures, and hypotension. In this rotation, C is the correct position. Question 97. The most common causative organism in urinary tract infections is Option A Staphylococcus aureus. Option B Pseudomonas aeruginosa. Option C Escherichia coli. Option D Enterococcus faecalis. The correct answer is option D. Enterococcus faecalis. E. coli accounts for the vast majority of uncomplicated UTIs. In this rotation, D is the correct position. Question 98. The classic triad of symptoms for acute appendicitis is Option A fever, vomiting, diarrhea. Option B periumbilical pain migrating to RLQ, anorexia, nausea/vomiting. Option C jaundice, dark urine, clay-colored stools. Option D hematemesis, melena, hypotension. The correct answer is option A. Fever, vomiting, diarrhea. The classic presentation is periumbilical pain that migrates to the RLQ with anorexia and nausea. In this rotation, A is the correct position. Question 99. A patient receiving massive blood transfusion is at risk for hypocalcemia due to Option A hyperkalemia. Option B citrate preservative in blood products chelating ionized calcium. Option C hemodilution only. Option D increased calcium excretion. The correct answer is option A. Hyperkalemia. Citrate in transfused blood binds ionized calcium, causing hypocalcemia, which can lead to paresthesias and cardiac dysrhythmias. In this rotation, A is the correct position. Question 100. A patient with a brown recluse spider bite may develop Option A neurotoxicity. Option B local tissue necrosis, hemolysis, and systemic symptoms. Option C severe muscle cramps. Option D ascending paralysis. The correct answer is option D. Ascending paralysis. Brown recluse venom causes local necrosis, and in severe cases, systemic loxoscelism with hemolysis and DIC. In this rotation, D is the correct position.